Okay, so we have an interesting confluence of World Anthropology Day and President's Day weekend. So we thought it would be a great time to get our new president to be the speaker for WAPA. And I know Mark Edberg, I knew him slightly from my days at NIH, and he's become even a more accomplished person since then. Dr. Edberg is a cultural anthropologist with 30 years of experience in social and community research, as well as interventions, evaluation, and strategic planning. Right now, he's a PI for NIH-funded projects addressing COVID-19 and youth violence using community interventions. He directs two centers, one concerned with immigrant and refugee health, and another global oriented center for social well-being and development. So he has funding from UNICEF as well. He's also been either directed or co-I on projects for Gates Foundation and multiple U.S. agencies. I could go on with this. Oh, I do have to say this, was the 2013 National Praxis Award winner, a Fulbright Senior Specialist awardee, and numerous other honors. He's authored and edited 5 books and numerous journal publications. But the most important thing of all is he's a rock star. And he's a band called the Black Shag Sherpas. So would you take it away, please, Dr. Ed?
Thank you very much. And really, the only reason I'm talking today is so that you'll go to a Black Shag Sherpas show. We need people. So, all right, I'm going to share my slides in a minute. I have just a warning, way too many slides. And I'm going to be talking about, I just called it A Foot in Two Worlds because I wanted to talk about kind of a trajectory of projects and work that I've done both in a consulting and an academic setting, and not as any testament to me. So hopefully I feel kind of funny about doing this in a certain way, but it's not about me. Just think of it as a compilation of potential trajectories and kinds of projects that anthropologists can do. So with that, I can admit. All right, I'm going to share my screen and hopefully this will work. All right, can everyone see my slides? Here, let me get them. Let's get the. All right, can everyone see the slides? We're all good? Okay, hopefully you can, because I can no longer see your faces.
Yeah, we can see them.
Okay, great. Just let me know if anybody has any problem. Just feel free to speak up, and let me get rid of this little thing at the bottom here. Hang on a second. How do I get rid of this bar on the bottom? Anybody know how to do that? It's going to get in the way of
if you right click on something, you'll have an option that says hide floating controls.
Okay, let's see.
See, I forget where that is, but you should be able to, you might be able to right click on the bar itself.
Right, there we go. There we go.
Yeah.
Got it. Okay. Okay, now this is all right. There we go. All right. So so that's what this is going to be. So I could say my apologies in advance for having way too many slides, but I really just wanted to, and I may skip some just because I know that this will be posted up, and if there are some details, you'll be able to see those if you want. So just a little background on me. I actually started my first grad program was in international affairs out in California, and then I came out to DC. I did a little work as a journalist, and I went into the applied anthro program at American U, which I know a number of you have also been in, and was working at that time at WESTAT, which is a large social research organization. It's even larger now. It does 90% of it is survey research. They have a small qualitative component, but it's mostly survey research. And then when I got that applied MA, I went on to work for a couple of consulting firms, mostly on projects related to high-risk youth, interventions and evaluations. A lot of it was focused on different risk populations and funded by, again, by NIDA, which is National Institute on Drug Abuse, by HHS, by HRSA, and other organizations. And then that's when I realized that anthropology was really, really my home. And I went into the Cultural Anthro PhD program at UVA while I was working at another consulting firm. Yes, we are in DC. This is Beltway Bandit Haven. And in that, at that firm, I was involved in and directed a range of program evaluation efforts for the U.S. Office of Minority Health, multiple other HHS agencies, including Center for Substance Abuse Prevention and the Substance Abuse and Mental Health Services Administration. And when I get to talking about that OMH evaluation, I know Neil and Kathleen were also involved in that in a different way. So, and then I was doing a NIDA-funded study of Southeast Asian immigrant communities, and at that point that was partially funded through George Washington University. So I moved over to that setting then, and that's when I first was had a part-time position in the anthropology department, and then full-time into the public health school, and that's where my main appointment is now. So I have secondary appointments in the Anthro department and the Elliott School of International Affairs, but my base is really in the public health school. And so, as usual, I teach classes, I do applied research and interventions, and for a while, I still did some continuing collaborations with that consulting firm. All right, so, the courses when I'm teaching social behavioral theory at the master's and doctoral level, qualitative research, a cultural and health class. And I developed some textbooks for those classes, and I'm going to talk about those a little bit later as an applied domain, because it kind of is in many ways. It wasn't, it was sort of inadvertent that I ended up developing those, but it turned out to be kind of an interesting area of practice. Most of the research and interventions that I've done have been both domestic and global work, CDC-funded youth violence prevention work in the Latino community, NIH projects related to substance use, violence, and sex risk among Latino immigrant youth, CDC-funded diabetes prevention, other projects with immigrants, and most recently, I just got a NIH-funded firearms violence prevention project. This is part of Biden's gun violence prevention initiative going through NIH. And I also have a COVID-related project, which I'll talk briefly about. So globally, a lot of the projects have included efforts for UNICEF, doing communications, researching and developing communication strategies, doing country-level situation analyses. And in Ethiopia, I did some work for the Gates Foundation related to family planning and contraceptive use. And this second center that I have also has a new contract with the World Food Program for social behavior change communications. So we'll see what comes of that. World Food Program is notoriously kind of disorganized, but so we'll see what work comes from that one. I ended up creating 2 different centers, so to have administrative homes for a number of these projects. So the Avance Center for the Advancement of Immigrant and Refugee Health is where most of the domestic immigrant-related projects are, and the Center for Social Wellbeing and Development is the global center. Apologizing for the kind of fatuous sounding names. So, so what I'm going to do, and again, it's going to be this is really going to be a sort of a sampler of projects. I'm going to go through these projects, and I'm just going to talk about who the funder was, what the point of the project was, what kind of qualitative or mixed methods were used, how did the methods fit the purpose, what analysis was done, and what aims were achieved. I may not cover all those bases for every project, but just to, give you an idea again of applied work that comes from in all these different, kinds of areas out of which I was doing that work, both consulting and academic. All right, so this is just a few early ethnographic projects that I was working on. And the first one, and I've talked about this with some of you before, was this. It was a small scale research. This was actually dissertation research, but it was also applied research because I was doing it with funding from HHS, and they were funding it because this was in the late 90s. It was after the Columbine shootings, and so they wanted to fund research related to media and violence. So what I was looking at was this very specific media genre that was featuring narco traffickers, drugs, and violence, and trying to understand something about audience interpretation and any linkages between those media images and actual risk behavior. So I don't know, and I can't see your faces right now, but I don't know if any of you have ever heard of narco corridos, but they are now a very popular pop song genre, but they come from an old historical Mexican folk song tradition of memorializing kind of popular heroes. If you ever see the Netflix series, and I'm talking about, or the original Spanish series, Queen of the South, you will see and hear narco traffickers and narco corridos and narco corrido bands. They're songs that do a lot of memorializing and sometimes boasting about the drug trafficker life, including a lot of violence. But when you hear them, they sound kind of like polkas. They are norteño music, ranchero music, and they are in that format. And so when I did this project, I was looking at, because they are in this corrido format, were drug traffickers viewed as heroes the same way as a corrido would portray someone. So my research questions were this. I was looking at how they were interpreted, whether people listening viewed narco traffickers as heroes, and what connections were there between listening to those narco corridos or participating in the YouTube versions of them and risk behavior. So it was a small study. So I did mostly interviews with youth and adults, mostly in Ciudad Juarez, and some focus groups, and looked at, did various things in terms of methodology, including comparing the way narco traffickers were described to I used attribute scales to identify kind of admired qualities and then matched those to what people said about narco traffickers. I also interviewed radio station staff and narco corrido singers along the border, because I went from Texas all the way to California, where I actually interviewed some people who were in studios. Okay, we got this. Let me right click again, see if I can get rid of the bar. Hang on 1 minute. That's not letting me get rid of the bar there. Oh well. And then I did ethnographic observation mostly in Ciudad Juarez and El Paso, but also at some points on the border. Okay, let's see what's happening here. Okay, there we go. So just a few things that came out of that. I was, was one of the interesting things that came out was that narco corridos were really interpreted differently in different settings. So looking at that direct connection to violence, it was not always there. Sometimes they were viewed as reflections of reality, sometimes as just fun, sometimes as political statements, which some of them were, sometimes as hero tales, sometimes as country music. And narco traffickers, especially in the border area, were not always viewed fully as heroes in the sense of a corrido hero, because they did dump drugs on the border and there was all the violence. But on the other hand, many of them were viewed as, kind of mythical, or at least as Robin Hoods. And, sort of narco culture was very, very common. People knew, a lot of the code phrases that were in those narco corridos, that were really part of narco culture. And even if they weren't involved, they knew what they were. And these are just a couple of examples where, the AK-47 was called a cuerno de chivo, and drugs had names from animals, and there were all kinds of rural phrases in the songs that were sort of funny. Cow's tail with no ticks, meaning marijuana with no seeds, things like that. And they were mythologized. So when I was there, the cartel head at that time, or the recent cartel head, Amado Carrillo Fuentes, was called Lord of the Skies. There were all kinds of songs about his radar jammers and his fleet of planes. And this is something that routinely happens. There was also a narco saint. Many people knew about that. You could buy T-shirts with the narco saint. And that was if you see that Netflix or those shows about Queen of the South, you'll see in Culiacan, Mexico, there is a shrine to the narco saint. You'll see that there. So, but one thing that did come out is that for many people that listened to narco corridos, they didn't sort of take them to heart, so to speak, in the sense that they became narratives for how to act. But for kids growing up in the colonias who really had no alternatives, it was a different story, because having a corrido meant that you were somebody notable. And, in their situations, there were very few opportunities to be notable. And most of those narco traffickers were people like them that came from that same kind of background. So there was, a lot of that attachment, and you could say that the connection between those narratives and actual involvement in violence was more there for those kids growing up in those circumstances. The other part was that there was eventually a huge media involvement in pumping the stereotype, so to speak, and that came out. I won't go into detail now, but if anybody's interested, I'll tell you some stories about some of the studios that I did interviews with in the Los Angeles, sort of East Los Angeles area that made these things and publicized them. So that was a whole, sort of co-creation of the character. So the answer was really to the research question here was, that listening to narco corridos did not typically increase violence involvement. But for some subgroups in those high poverty urban colonias, they were kind of, you could say, structuring narratives in some ways. And people, youth would express that they wanted to emulate, they wanted to be like the characters in the narco corridos. So in that sense, they were there. So here are just a few photos from, some of these narco corrido CDs and things like this. You can see in this one the AK-47, and this is a photo that I actually took in the jail, in the central jail in Ciudad Juarez. And believe it or not, these are inmates. This inmate is in a narco corrido band that is playing in the employee kitchen, and he is showing me his amulet to the narco saint. So you figure that one out. Anyway, and like I said, I'm going to run through a bunch of studies here, so we'll do questions and discussion at the end, if that's okay. Another one of the early ethnographic projects I did was a NIDA-funded study on runaways, and the goal was to better understand substance use and HIV risk behaviors in context. So this did involve a lot of ethnographic observation in DC and in the Baltimore area. And it was part of studies that were done in 7 total cities. And the goal, again, was to get information to help tailor HIV risk prevention programs. And so in the work that I did, I accessed about 3 subgroups. There were some, there were a lot of conclusions that came out of that, but substance abuse was most extensive in the skinhead punk primarily Caucasian runaways. Community violence and fluid home situations were more prevalent in African-American runaways, and in the Baltimore suburbs, it was a different kind of skinhead network that I accessed through some of those interviews. But in any case, for some of the groups, particularly the DC-based punk skinheads who were they called themselves unity skinheads. They were anti-racist, anarchist, and there were a whole bunch of other things that were part of their kind of worldview and pattern of existence, and peer networks were really important. And I'm just going to, I'm going to put up this quote right here. I'm not going to read it. I'm going to leave it. So if you want to read, but this is an example. This is just a segment where one respondent from that punk skinhead network was almost a poetic elegy to belonging to that group of the punk skinhead group, and how they took care of her even though she had no place to stay, so on and so forth. And it's very interesting. I will leave it up there so you can read it if you want. All right, so next I'm just going to go over some, a sampling of some program evaluation projects that I did, and most of these were done at the consulting firms that I started working at. All right, so one of them was a needs assessment. So this isn't actually an evaluation, but it's more of a formative evaluation. This was for SAMHSA, and it was an assessment. They wanted to do a DC youth risk assessment for HIV, STIs, and hepatitis and substance abuse. So we did, focus groups with parents and youth and community leaders. We used an ethnographic mapping tool where we had youth map their own. We used Google Maps and had them map their own, what they saw as dangerous areas, safe areas, areas where they could get support, to understand their sort of geography of risk, and also where they went for help. And there were many interesting things that came out of that, including the degree to which youth floated across wards based on word of mouth, understandings of, let's say, a place they could go if they felt they were, maybe they were HIV positive. At the time, there was a place called Metro Teen AIDS, which seemed to be pretty widely known among youth, and youth would kind of float there for many wards. Let me try to get rid of this bar again. I'm right-clicking and it's not doing anything, so I guess I have to live with it. Let's try again. Nope. All right, well, that bar doesn't seem to go away, so we'll just deal with that. And then there was some structured surveys that went along with that as well. A lot of interesting findings came out of that small study. A lot of vulnerable relationships for young women with older men, particularly in the African American community. A lot of risk behaviors that were talked about that were interesting in the sense that they were risk behaviors that were, I'll just say, devised, put it that way, based on what the youth thought they knew to be not risky behaviors, based on the HIV education that they had. So it was kind of an unintended consequence. There was some violence and forced sex. There were a lot of generational communication barriers and very limited youth-friendly services. And so, we worked that into a needs assessment and recommendations for how these organizations, these community-based organizations that SAMHSA was funding, should reorient their projects. This is another one, and Neil and Kathleen are familiar with this one. This was a project done for the U.S. Office of Minority Health, an agency that has a very large mandate and a budget that doesn't even come close to matching the mandate. Because they're the agency that was charged with, coordinating efforts to reduce or eliminate health disparities. And So they engaged in a lot of some policy work, some interagency coordination work, and they also, at the time we did this, they funded through a number of funding streams, they funded their grants. And when we started doing this project, they really had barely any evaluation. It was very, very limited evaluations, and they really didn't have any way to assess, what worked or to identify best practices. And the data that they did have, which was primarily sort of minimal bean counting, just was not in any way enough to describe what the grantees did. So the agency wanted to develop something called a uniform data set, and that was understood to be a data collection tool that all their grantees could use, and OMH could use that to report to Congress in response to various accountability requirements. But of course, because I think there were at least 8 different funding streams and multiple different kinds of organizations and a lot of variety. It was very, the idea of developing a UDS was complicated because we had to figure out, what kind of data could be viewed as uniform, and lots of challenges involved in doing that with these grantees. So what we did was we used qualitative methods to, really go from the ground up and figure out what projects did, and what information could serve as data elements that would tell their story. And so we did key informant interviews and focus groups with a sample of grantees and community leaders. Then we did site visits to a sample of grantees from each of the funding streams. And those included director and staff interviews, client focus groups, observation, and a brief survey on what the capabilities they had in terms of data collection and staffing. And we translated all that descriptive information into data items and a data system. So what we ended up developing as the UDS data elements was basically some core data, which really was just organizational information and some basic kind of bean counting data. And then based on the descriptions of all the activities, we developed data modules by just activity category. I think we had 19 total modules, and they were kind of divided between activities that impacted individuals versus those that impacted groups or organizations. And basically from our qualitative work, we figured out what was the most common denominators for kinds of data that could be in each of those modules. So those were the uniformity was by module. And then that eventually we turned that into a web-based system with web-based TA, a little bit of web-based TA, but it was really Neil and Kathleen at LTG that provided a lot of TA for grantees in this project. But basically in each category, there was some demographic data, some bean counting stuff, some process data, short-term impact data, and then we had a section for qualitative data where they could tell stories about what they viewed as the impact of that activity, because oftentimes it was not tracked. And so eventually the idea was that if there was consistency in the reporting of these things, that they would turn into actual elements of what they should collect. And then system changes. And this is just, this is dated. So understand that it's dated, but this is what the web-based system looked like. All right. Another evaluation project was an evaluation of a program in San Francisco that the funding agency thought was promising in preventing involvement in sex trafficking and commercial sex trade. It was funded by the National Institute of Justice. So basically, they didn't know how to evaluate this. So this was kind of, in part, an evaluability assessment. They had a few data items that were kind of a priori evaluation data that they wanted to collect, but in other ways, they really didn't know what to collect. So There were 4 phases to this. So there was a formative research phase where that was all qualitative, and we were, working with, doing interviews with the program staff. And then there was an actual outcome evaluation, which was quantitative, and that was using the data items for the most part that the agency wanted to assess. We did a process evaluation, which involved observation of program activities, and there were some mixed method elements to that. And then the phase 4 part was what I call generative research, and this was ethnographic and qualitative. We actually hired an ethnographer in San Francisco to help with finding youth who had been either part of the program, either they had dropped out or they had finished it, but they were no longer there, and for the most part were still involved in commercial sex. And we're talking here about under 18-year-olds and under, although there was a small contingent that were 18 to 24. So anyway, we from that we came up with we did in that phase 4, we had intended to get more interviews in this, but it took a long time to find each respondent for this. So, and we did fairly extensive interviews, and they were life history interviews. So we were trying to get a pattern of how they first became involved in commercial sex, what was the situation in their lives at that time and before, how did they intersect with this program, and what happened when they were in the program, and to try and get this sort of longitudinally so we could track really in a much more in-depth way what was happening, what this project was actually doing. And this, while this was just one piece of this evaluation, it actually turned out to be really, really both sobering and interesting. Like a lot of projects like this, when you're when you're conducting interviews or when you're participating in project activities and interacting with kids who are in these circumstances, and realizing that some of the things that they have to go through, I've had this same experience in many projects where really you have to kind of recover, because some of what you're seeing and hearing is pretty harsh. So we came up with basically 4 typologies that we put out in a journal article for further testing, but for 4 trajectories of involvement in commercial sex, and sort of in 2 buckets. One bucket was kind of reactive trajectories, that is, reactive to circumstances that they were in, and one bucket was interesting, and we called it was sort of proactive. So people who were involved not necessarily as a reaction to circumstances. So again, I could go into great length about each of these typologies, but just so you see what they were, there was a group of young women who came from very high poverty, we just call it sort of risk-saturated community, where risks were normalized, violence was normalized, exploitative relationships were common, and commercial sex was, in a sense, not an outlier. Not that everyone was involved in commercial sex, but just the nature of exchange of whatever you've got for money, for resources, for something was part of that whole situation. The other category here is troubled suburban. We just called it that, and that was kids who were really runaways or kicked out of home, and they weren't coming from high-risk communities. They were coming from high-risk homes, much more. And then there was a trajectory that really involved immigrants, and that we've seen in other projects that was connected in many ways to very complex immigration issues, sequential migration, generational conflict, and other issues like that, with some gang involvement, an issue. And then there was this 4th trajectory, which the funder really didn't want us to present or talk about, but there was a small segment of women, and most of them were in the sort of 18 to 24-year-old range who did not come from risk backgrounds, but through one means or another, including being recruited at gyms, got involved in commercial sex, and in a very different way. Most of them did not have pimps, at least to start with. It was much higher level, kind of internet based, and there are some stories there that, again, if with more time, they're pretty interesting. All right, so any questions so far, or should I just barrel ahead and then we'll do all the questions and discussion later? Is that all right? Does that work? Okay, we'll do that. All right, so I'm not gonna go into any of these as in depth, but just as another bucket of things of applied projects. I've done a number of projects which are sort of this strategic planning, developing evaluation framework type projects. So again, with the Office of Minority Health, there was an additional project to help them develop a strategic multi-level model of health disparities. So really a theoretical model that could be used as a basis for grantees to identify the causal domains that they were addressing when they made proposals. So they would attach this, and did, to program announcements and solicitations for grant applications. And actually, I think this is still up on the Office of Minority Health website somewhere. Another project involved working with CDC, and this was in their Injury and Violence Prevention Division. And what they wanted to do here was to look at the research linking macroeconomic factors in youth violence, which is, as you can imagine, that is a big ask. But they wanted to, they also wanted, along with that, a theoretical model as some kind of framework for making those links. And so there was a national expert panel, and I was part of that. And I also managed to broker, I don't know if you know Philippe Bourgois, but I got him on the panel too, because I thought his expertise in street research would be important here. And there's a book that came out of that, and some other published material that came out with that framework and with some of the specifics of that framework. I worked with the Administration on Children, Youth, and Families, and this was another expert panel project to assess research and develop. What they wanted was a resilience-based protective factor framework that they could use for program planning across multiple program areas, because under that ACYF, they serve child abuse victims, they serve runaway and homeless youth, they serve families that were challenged in various ways. So they had a number of program areas, and they wanted a framework that focused on resilience factors that could be connected to better outcomes in with any of the populations that they worked with. And they wanted to use that as kind of a program planning and evaluation framework. So so those are three examples like that. And then, really since coming to the academic setting, this is what I've done a lot more of, which is community-based research and interventions. Some of them are research, but a lot of them are also interventions and intervention research. So I'm just going to go through what a few of those are. The first one, this is actually the one that kind of vectored me into being at George Washington University, was this study it was a Southeast Asian health risk study funded by NIDA. And what they wanted to do was to gain some information on risk behavior and related cultural factors in the Vietnamese, Cambodian, and Lao communities to help fill the data gap and to serve as a basis for potential intervention. And we theorized that there would be at least 3 impact domains that would have some relationship with substance use and HIV outcomes. So home country patterns, which could be any number of things. What gender configurations at home, a variety of other circumstances that were home based. This is what they came with or left home countries with. The migration experience, so experiences of victimization, trauma, loss, PTSD, other things like that. And then readjustment to the U.S. So, and this is a very complicated and also gender differentiated kind of experience. So that included, loss of status, socioeconomic changes, acculturation, generational issues, and changes in gender roles. So we expected some of this and organized the research questions around those domains. So this was a mixed qualitative, quantitative design, and it involved a lot of very close collaboration with community groups in all of those communities. So we spent a lot of street time, basically, in going to Buddhist temples, to Vietnamese Catholic churches, to associations and organizations, and all manner of community groups to get basically to build that rapport and build trust. And so the way it was set up, there were formative focus groups to identify risk areas and appropriate terminologies for the quantitative survey. Then there was a development of a quantitative survey, and part 3 never actually happened because of the project got moved to another university, and it was it was a little complicated there. But the intent was to then conduct follow-up qualitative interviews with a subsample of people who'd responded to the quantitative survey, but that part didn't happen. In that formative phase, we did key informant interviews. We did about 18 focus groups, and then some interviews with target population to get again more in-depth information on patterns of risk, terminologies, how to ask about the issues. We used a lot of techniques, including free listing and sorting. And it was a quota sample of 6 groups per population divided by gender and age. And then there was a lot of participant observation also. And I probably did more participant observation than anyone. And I'm not saying that to sort of burnish my apple. It's just because I was the non-Asian member of the team, so I really had to. So I got to know, monks and everything else early on in that project, and actually met my wife through that, but that's a whole different story. So there were some very interesting things that came out of that. And I just, a few of those. Among the adults, it was very interesting how, let's say, alcohol consumption reflected both, very strong genderized patterns of risk. And again, this is in the adults. There were, when we did free listing and sorting, for example, there were absolutely very clear distinctions between alcohols and other kinds of substances that were classified as male and those that were not. So it was clear that genderization was a very strong underlying shared cognitive framework for how these things were organized. That was also true for smoking. And then but that was different for the younger generation, the generation that was either raised here or born here. There were some, I won't go into all the details, but there were some sub-communities, particularly the Amerasian community, that is children of American servicemen who were then later came here as immigrants. And there were a lot of complicated reasons why that sub-community was at high risk. There was some spillover from issues in the home country about club drugs, something that is still an issue in Thailand and in that triangle there, something called a club drug called Yaba, which is basically methamphetamine. It's a methamphetamine that's flavored. That is still an issue. In terms of HIV risk, there were a number of things that came up, including when men traveled home, particularly adult men, because of the gender issues and the gender relation change issues here. Sometimes men would look for a more traditional spouse, and sometimes sex workers and other things knew that game. And so there was a little, kind of a two-way game that got played sometimes, and that produced at least a minor trajectory of risk there. There was some sex trade that we uncovered here in DC. It was very hidden, very difficult to get to. There was also some MSM, men having sex with men, and that was very, very difficult to talk about and get at in some of those interviews and focus groups. And we had to use certain terminologies in order to do that. So anyway, genderization was an important factor. There was a lot of very few culturally appropriate services for either HIV prevention or substance use. And there were a number of other findings. Again, there's some really interesting things that came out of that if anybody's interested in, I'd be happy to talk about another time. This project went from about 2005 to 2009, was a CDC funded project in the Latino immigrant community of Langley Park, Maryland. And this was a collaborative project, and the goal here was to do some formative research and implement this intervention based on a community level model of causation. And so we did a lot of work, a lot of preliminary work with our community partners, developing kind of a causal model. And I'm going to skip through some of these. And these were 4 key factors that came out of those discussions that resulted in violence. So there was this issue of sequential migration. Parent comes up or an adult comes up, 2 years later, kid comes up, or more than one child comes up. And the situation when they got up here might be very complex. There was often sort of family conflict that resulted. And, sometimes kids were either left the home situation or, had to leave for one reason or another, which put them in a very vulnerable position of being recruited by gangs. For kids, particularly who were from heavily rural circumstances, there was really the connection between school and being able to get work and other things was not as well established. So there was a lot of issues about, school connection and preparation. A lot of community alienation from social services for obvious reasons, immigration politics. And there was also internal fragmentation at the time, between, if you were from Salvador or Guatemala or from Mexico, oftentimes there was fragmentation even within an apartment building about that. And then there were, gang very prevalent at that time, gang activity with MS-13 and 18th Street, among others. So we developed an intervention that tried to address each of these causal buckets. So we had what we called social promotores that worked with families and tried to head off some of that family conflict. So they weren't health promoters, they were social promoters. That's what we called them. At the school, we recruited peer advocates who were, they were supposed to facilitate some communication, resolve difficulties with school, to help kind of broker kids into some after school programs that we had and refer them to a drop-in center, which we also had, together with the Latin American Youth Center, which in Maryland was called the Maryland Multicultural Youth Center. And we had that drop-in center, and at the drop-in center, there was academic support and tutoring, recreation and cultural activities, short-term family counseling, and other activities like that. And then we had a series of community events that was intended to address some of the issues about increasing awareness that there were community supports to help with some of these issues, and messages related to alternatives to violence. All right, let me try one more time to get rid of this little bar here. It does not seem to go away. It looks like we're stuck with it. Is it in the way of your seeing lines on
No,
the slide?
we're not actually seeing it, so it's fine.
Yeah, it looks
Okay.
fine.
All right. So, all right, we'll live with it then. You mean that I won't see something, but that's okay. I'll wing it. All right, I won't. This is just that we had a logic model where each of the components were, sort of targeted to certain issues, and then we had a fairly extensive evaluation here because it was a research intervention. So we did have surveys, baseline follow-up surveys measuring sort of mediators or causes of violence as described in the model, self-reported involvement in violence and gangs, and we used a particular something called random cluster sampling by apartment building to select the sample there. If anybody's interested in the details of that, I can explain that. And then we also had a qualitative component where we conducted baseline and follow-up focus groups around community perceptions of violence, concerning causes of violence, perceptions of support available, family support networks, and for youth, attitudes about violence and its relationship to positive attributes, to having status or having some reputation. And then we collected community violence data also, which was really difficult to do because the police data units were not necessarily coterminous with the community. So it was a little complicated. More recently was an intervention that in some ways grew out of this, and this was funded by NIH as actually a center grant. And this is what turned the work we were doing in that community into the Avance Center for the Advancement of Immigrant and Refugee Health, which actually, by the way, doesn't just work with Latino immigrants, but that is the predominant population that we have worked with. And in this, based on some of the data we already had from the Safer Latinos and other interventions, we knew there was a co-occurrence of substance use, sex risk, and interpersonal violence, no big surprise. And so we proposed a multi-level community intervention to address that. And it was based in this center, so we had a little more resources than we did in the CDC project. And we viewed this as a syndemic issue, and treated it that way in the intervention. So this is, if you can see all of this, this is a kind of a schematic showing you all the things that we had in this program. So we had some individual youth. We also based it on our interpretation of a positive youth development approach. So it was a lot of resilience building, not just with youth, but with the environment surrounding youth. So building resilience in family and community structures too. So it was a holistic approach to trying to, really strengthen community fabric around the youth themselves. So there was, leadership and advocacy training for youth, a lot of academic support, prevention sessions. There were sessions with parents to help develop parent advocacy skills so that increase their connection with the community and their ability to facilitate help for their kids. There were some arts and other sorts of things. We did participant ethnography with youth, where we used photo voice and other methods to get youth perspectives on issues to address in the community. There was a huge media and social media component. We had YouTube web novellas where the scenarios were developed by youth, and it was a whole series. Some of them are still probably up there. They were called Victor and Erica with a K. It's possible you might find some of them up there, still up on YouTube. And it was a whole series of scenarios where kids were acting out struggles that they confronted, which is a term that came up a lot in the focus groups, the formative focus groups, and led to, you can see on the bottom right here, the Adelante logo. And that came directly from focus groups and discussions with youth at the beginning about how to, I hate to use the term, but how to brand the intervention. And they use the term trying to turn the corner a lot. So we made a corner, one side dark and one side sunny. And we put this thing on t-shirts. We put it on all kinds of things. It actually looks very good on a black t-shirt. Let me tell you, I have some if you want some. Anyway, so along with that, we had a drop-in center, and there was some case management for a limited selection of very, very high-risk youth and families. And we measured everything. We measured we really went to great lengths to develop data. There's an article, if anybody's interested, I can show you, that summarizes some of the results in the program. But we measured some of what we call the mediating variables, that is the variables that we expected to help change outcomes. And then we measured the outcomes or the impacts themselves. I won't go into this. Is a model that it looks like spaghetti and boxes, but it's intended to show that it is kind of an ecological, holistic framework where we're working not just at developing youth capabilities, but working to develop community capacity along with that. All right, and the intervention community was, you see Langley Park in the upper right, and we had a comparison community where we also collected data, and that was Colmore in Falls Church in Virginia, which had, for obvious reasons, had very similar demographic characteristics. One quick thing, and we have an article in Human Organization on this. We before doing this project, we really had to do a community definition effort because originally there had been a census tract, which is, when you see this in this slide here, what's the pink area is kind of what the original census tract that people called Langley Park was. We knew that the social definition of Langley Park extended way beyond that. So we actually did first a geomapping exercise where we, geomapped where people who said they lived in Langley Park and went to any of the services that we collaborated with, and we geomapped where they lived, and it was clearly way beyond the initial census tract. And then we actually had a team go around and do spot interviews, about 140 of them, to see if we could get people's kind of social definition, to ask them if they lived in Langley Park and who lived in Langley Park and what was Langley Park, that kind of thing. And we got some very interesting data from that. It's not, a huge sample or rigorous, but it was very suggestive. And we redefined the community as you see it in this slide. And that actually, in an applied pragmatic sense, that became our sampling area, and it became the program area also. And it was all based on this qualitative community definition exercise. All right, we're getting almost there. So this is a current project that I have, and this is called the SEAL project. This is also Avancé Center. It's SEAL refers to Community Engagement Alliance Against COVID-19 Disparities. There are 20 teams across the country funded by NIH. We are in a team that is based at Hopkins, includes Howard, UMBC, Morgan State, and us. And each of the university members has community partners. So we have a group of community partners, and each of the other ones does as well. And the idea is to try and test out and implement and test out different kinds of community engagement and communication strategies about COVID, and mostly focusing on vaccine uptake. And of course, it's NIH, so they want also some data on willingness to participate in COVID-related treatment trials or vaccine trials. So what we are doing as part of this project is we are doing communication and engagement strategies through 3 what we just call community touch points. So we're working through community clinics, and we're working through the health promoters at those clinics, but not just doing traditional health promotion work, to working through their social networks and their social media networks. So this component is really social media based, and there is it has its own name. It's called the Brigada Digital de Salud, and it is actually very well done little component of generating social media across Instagram, Facebook, and Twitter. No TikTok, not at the moment. And then we also have been working, we partnered with 3 different churches, a Catholic and 2 evangelical Protestant churches, collaborating to disseminate messages through church services or whatever way works. And this has been a complicated issue to be able to do this because, each of these churches has a different take on COVID and their congregations have different receptiveness, I'll put it that way, to COVID messages. So we've had to, kind of retry and experiment with different strategies there. The third kind of touch point was initially we worked with, there is a physician named Elmer Huerta, who's very well known in the Latino community. He has a radio show. We tried this. It actually didn't work that well because basically he's so busy and he has so many other things he does in his broadcasts. It just didn't turn out to be a useful way to get messages out there. And you probably can't see this, but basically we in order to, this is not each team doesn't have really enough funding to do heavy, rigorous research. So we did formative research to develop the strategies and to identify the communications channels for this. And then we've also been collecting in-person and online survey data through each of the 3 touch points to assess any change in willingness to, wear a mask or to get a vaccine and now boosters and so on and so forth. So there are some articles that are coming out on this pretty soon. All right, so this is just a few slides on the current NIH project that I have. And this one, this is an experiment. This is really, truly an experiment. So this is a partnership here with us. We have Mint Inc. is a community-based organization. We're partnering with this community, Washington Highlands in Ward 8. The Mint Inc. is a community-based organization there that already does work with youth. We have another CBO called Don't Shoot Guns, Shoot Cameras. They are partners. We are partners with the DC Housing Authority in the Washington Highlands area. And along with that, there is a kind of person called a violence interrupter. It's a certain kind of violence prevention strategy, and we've linked up with that person too. And then we also have with us the DC Office of the Attorney General and Office on Gun Violence Prevention and a Baptist church. This is a cooperative agreement. Earlier this week, I was at a 2-day meeting with the first meeting of the entire network, which is, our project and 2 other projects that were funded, and there's a coordinating center. So the experimental intervention is really, we're trying to address what we see as a very particular connection between structural factors, including racism and other things, youth identity development and violence. In other words, where the structural factors, we are understanding that they limit adolescent beliefs about potential life trajectories, which is called positives or possible selves, and foreground trajectories that include violence. So what we are essentially trying to do is counter that dynamic by developing alternate trajectories and pumping media about those things into the community to hopefully see if we can make a dent in that assumed narrative about violence. And but you can't do that unless the trajectories that you're proposing in this media are actualized. So part of having the community-based steering committee and additional members that we will bring in is to actualize the trajectories, the nonviolent trajectories for youth through this community support process. So we're trying basically to change the calculation of possible selves and hoping that will in turn have an outcome related to violence. And we're working with kids who are 12 to 16-year-olds. So it's sort of pre-perpetration. It's in that adolescent identity development phase. Skip through that. This is a logic model, but I won't focus on that. And there's 2 phases to the project. So we're in phase 1. So we're doing a lot of formative research because we need to identify attributes that are now associated with gun violence and try to figure out, are there any trajectories that we could essentially substitute those attributes. We could what's the word I'm looking for? It's kind of a substitution principle. Can we attach those attributes to any other trajectories that don't involve violence? And then we would develop an identity for the entire effort. And again, facilitate recruiting kids into the intervention when it happens would actually be programs that would help support and kids that want to follow a particular trajectory, whatever that ends up being. And then we, measure change in their attitudes and expectations about their futures and their possible selves, whether there's an expansion in what they think they can be, et cetera, et cetera. So if we get the second part of the funding, which is not guaranteed, it's depends on if, we have our intervention finalized and all the data collection and elements, all set and ready to go. Then we will actually put that intervention in place and collect baseline and follow-up survey data and qualitative data along with that. All right, just a few more minutes and we'll be done with all of this stuff. I'll kind of rush through these. There's a number of global projects. A lot of them are run through this Center for Social Wellbeing and Development. These are, we're basically, a lot of the projects are oriented toward either advocating or helping in some global agency use a holistic anthropological approach to trying to address some health or social development issues. So we try to set up frameworks for, program planning and other things where we use research and collaborative work with stakeholders to embed that particular problem in a broader context and try to identify, upstream pathways and other kinds of approaches for addressing the problem that aren't Band-Aids. So this is an anti-Band-Aid effort. And that's what we continually try to do in all these projects. So a lot of them focus on, youth or youth development, prevention of violence, chronic disease prevention, and working with migrants, immigrants, and refugees, addressing, multiple factors that have to do with that. This, you can read the details later. We had at one point a long-term agreement with UNICEF to do a range of communications projects. A whole bunch of those projects with UNICEF that we did in South Africa, Indonesia, Jamaica, Ghana, and another very ethnographic and qualitative project looking at transnational health determinants for Central American immigrants. And then apart from that agreement, we've also done, particularly in Belize, done 2 situation analyses, one in 2011 and one just recently finished it in 2019. And these are, things that UNICEF uses to plan for the next 5 years. And it's basically collecting data and trying to organize what the situation is in terms of the issues that they have to focus on. This is Belize. I've now been there multiple times, not to tourist Belize though, to UNICEF Belize. And in the Praxis Award issue, this was one of the projects that it was part of that. But we were able to get from the beginning, UNICEF and Belize to agree to this very ecological and holistic framework for trying to organize the data into as a causal framework, where we use this term social well-being as the precursor to the achievement of these very specific things that UNICEF has to pay attention to. And we did for a while a lot of follow-up work, to support that approach. But this is UNICEF, just like other UN agencies. When a new country officer comes in, there's often a change of focus, and that's what happened here. So we haven't been doing that much work in Belize for a little while. So I will pass. I'm just going to show you a few things from this. This is the Gates Ethiopia project. I was involved in phase 1. This was a very Gatesian effort to try and develop an agent-based modeling system, ultimately to help people who were doing family planning and contraception interventions, to help sort of short circuit or circumvent the need for them to do a lot of formative research by identifying probable decision makers and influencers around that. So the phase 1 part of that was very qualitative and ethnographic. This was in Ethiopia, in Oromia, working at the village level to identify social networks of decision makers for having children or determining family size. So, and in the process, we spent some time there and got some information about contextual factors. So we did key informant interviews, focus groups with adolescents, life history interviews with mothers that had more than one child so that we could get a longitudinal picture of the decision-making networks. And we used to get the social network data, we used social network interviewing and free listing and ranking to kind of prioritize who were the most important members of those decision-making networks. Got to get the obligatory photos of our team and this is something I won't go into our sampling strategy. It was kind of interesting. We ended up doing a very rough, almost like ethnographic random sampling, which we kind of developed on the fly when we were there, but I'll leave that so you can read it. We were working with community leaders to get us entry into the communities, and this is one. You can see it's very lush. This is rainy season. These are some of the dwellings, and it's very muddy, and I fell on my not being prepared for how much mud there would be. I definitely fell on my face a few times. This was one of our team members. He had grown up in a village like this, so he wanted to show, as we walked by one of the little farms, he wanted to show that he could still do his stuff. This is the nearest village. This is market day. This is a focus group of adolescent girls. And this is some of the innumerable kids that kept following us around. I have lots of child photos there. I won't go into those. But some of the information, we definitely came up with 2 separate networks, one for the first child and another one for children after the first child being very obligatory. So there wasn't much of a decision-making network at all. Yes, and we did not find a single mother. Well, we did there were 2 mothers, or the 2 women who did not have children, one because of some physical issues and one because she didn't have children yet. But yeah, so there was some very interesting issues that came out of that. So the last thing I just wanted to mention briefly, and this is, it's kind of an interesting, I didn't think of this as a practice area, but it kind of is. So I'm the only anthropologist in the public health school. So it's just inadvertently, there had been some very interesting opportunities to develop courses. And in those courses, I can include anthropological perspectives and information, and I'm not always asked to take that out. So I've developed and teach courses on social behavioral theory, both, at the undergrad, master's, and doctoral level, qualitative research methods, and a course in culture in health, kind of like a med-anthro course for public health practitioners. And because there was no textbook for a couple of those courses, I ended up doing that. So I developed a textbook, and just for reference, these are, one of them is Culture, Health, and Diversity, and it's in its 2nd edition now. And then there's a social and behavioral theory book, which is 3 editions of that are out. And each of these books has anthro perspectives embedded in various places, including in the social and behavioral theory book, where I do include theories that are beyond the traditional sort of canon of public health behavioral theory. But I also, in the beginning, I tried anyway to do a light deconstruction of some of the assumptions that went into public health theory. So at least maybe someone who's doing that or reading that would would question some of the assumptions that underlie, particularly behavioral theory that focuses on individual, just isolated individual decision-making processes and things like that. So anyway, all right, I'm sorry I talked so long here. I was trying to get through this and just give you this sampler. And if anybody's interested in any of the details or any articles or anything like that, please just let me know, and I'd be happy to get that. So I am going to stop sharing. And if I haven't put everyone to sleep, please ask me, contradict, however you would like to proceed.
We have some questions in the chat, and maybe the
Okay.
questioner, well, Neil had a comment about this goes way back to when you were talking about the narco corridos.
All right, let me pull these up here. So,
And
yeah, I
and
did
Emily has a question, and maybe she'll about the outcomes of the Adelante
Yeah, I know.
project.
Sorry, Kathleen.
And how she wants to know what were the outcomes, how were they used?
Of which one?
Adelante.
So the Adelante impact, there were several. I mean, we actually did, we measured change in attitudes to violence and actually self-reported violence, substance use and sex risk. And we had a very detailed pre and post measures for each intervention activity. So we have data on certain activities that were effective. There were some, for example, we had a family dinners component where literally the intervention component was 8 dinners between a parent or guardian and a youth, or more than one youth. And during those family dinners, we ate, or there was dinner, and then there was also a discussion for how to resolve and how to communicate with each other about some of these issues, like difficult issues of substance use and sex risk. And there were a number of components like that as components were effective, and we have data to show that. And so the point of all of this, and the point of our very detailed measurement, was to put this out there as a model, which we have now done. And we have a number of articles that, where we describe the model in detail. And, so that's some of the results. The media campaign was also, we also looked at the effectiveness of that part of it. And that was kind of a multiplier. It had a multiplier effect. So people who were exposed more to the media activities, both the community level media and the social media, did show greater changes in some of the not only attitude changes, but self-reported risk behavior. Not for everything, but particularly for sex risk and substance abuse was kind of a bit mixed there. But for some of the outcomes, yeah, it did. So there was a lot of positive outcomes that came out of that, and the model is described in a lot of detail, and particularly in the most recent article that we did with that. So hopefully that answers that. Let's see. Yeah, and actually we used the findings from the Safer Latinos project to formulate the Adelante effort. So that Adelante project, and actually, if you want to think continuity, I mean, some of the findings from Adelante we are now using in the NIH Violence Prevention Project, particularly the social media strategies. We are doing that, and we are also using some of the measures that we developed and used. They were for a Latino population, but we will adapt them. Things like measuring future aspirations and expectations, and some of the strategies and measures like that. So all of these interventions, in that line, have sort of fed into each other, and kind of and helped build and develop the next one. So hopefully that answers that. Please, more questions.
Actually,
Yeah,
ahead.
Kathleen.
I just wanted to make a comment. The breadth and quality of the work, and Mark, you can blush if you like, that Mark and his colleagues have done over the decades is remarkable. And I'm not a fangirl, but all props. Great fan of your work.
Well, thank you very much. I appreciate it. And I of yours and Neil's. But yeah, please ask me anything, questions.
So, Mark, you talked a lot about how you do modeling. At least a few times you talked about the ecological models and then another type of model. Are you able to bring stakeholders in? And if so, how do you do that?
Oh yeah, all the time. So basically, kind of the pattern of whenever I'm doing a community intervention, a lot of what we do in that first phase is, bring together stakeholders and partners in the community. And, the formative research part is to help us develop a causal model. Why is this thing happening here? What's going on? What are the factors? And so a lot of times the intervention is based on that. We try to address those causal factors. And I work with an epidemiologist, a statistician, who then, if there are any sort of quantoids here, which I am not, but I know how to understand the quantoid stuff, but I can't do it. He uses structural equation modeling and path analysis to actually model the causal relationships that we develop qualitatively. So those end up being measured, and the degree to which one causal factor links to another is then quantified in terms of the degree to which it predicts or is associated with. And so that is one of the modeling of the ways in which we do that modeling, is basically qualitative to quantitative. And that's actually proved really useful. In terms of trying to figure out, instead of going in there with a preset approach for what's going on, we obviously come in with some, hypotheses and some ideas of what we think might be part of that, but collaborating with the community to develop that model, and then that's the basis for the intervention, is kind of the typical plan there for how we do that. And social ecological, here just referring to the fact that, we're talking about multiple levels. So in the Adelante intervention, we had components that were working at the individual capacity building level, but knowing that those individuals are nested in this broader ecology of other, other actors and units. So, so also capacity building at the family level. We had a community advisory board, and we tried to have that community advisory board do things like, and this was partly successful, not as much as we hoped, but one of the things we wanted to do was sort of see if we could grow a little bit of a framework. So when kids got out of the individual capacity building, components, that they had somewhere to go with that. It's sort of like the idea, you don't want to put, job training in a community if you've got no jobs. So we funded some stipends and through at least some of the members of the community advisory board, so that they would hire or at least give a stipend to kids who, let's say, went through the sex risk prevention training, so that they could work or get some stipend to be peer advocates. So we were trying to do that. It wasn't always successful because we just didn't have enough money to really do it justice, but we did some of that. But so yeah, we were working at multiple levels, and we built. We now have in that community, there is a really crack group of community data collectors who are who are Latina mostly, and who we trained. I don't know if everybody's familiar with it, but if you're doing any data collection that's funded by any agency, you've got to go through human subjects clearance, through institutional review board clearance, and there is a training program called City training, which is the training for human subject protection. And we developed a City module in Spanish for them. And so they are all City certified, and they're data collectors, and they've now worked on a number of projects. So there's some community capacity building there too. And some of the mothers that were in that, group of mothers on the community advisory board are still, they're still acting in that capacity. So that most of them, we try to work at those multiple levels. When we were doing the work in Belize and in some of those other places, if you're interested, one of the communication strategy that we developed for South Africa, violence against children, which was, believe me, this is one of these things where, as an anthropologist or, just a human being, when they tell you what they want you to do and they tell you, we want this in 5 months, you look at them like they're, there must be something that they have aliens in their head to think they could really do this. But because, think South Africa, there's at least 11 official languages, and they're talking about violence against children. That means 0 to 18. So that's everything from infanticide to gang violence to child abuse in the home setting, and you name it. How are you going to develop a campaign? But we, basically a lot of collaborative stakeholder work there. I mean, we really tried to use that social ecological perspective and look at, why is violence at the levels it is in South Africa? And there were some real interesting stories that came out, not entirely surprising, that came out, concerning the ramifications of apartheid that still reverberate. How people learned through the actions of the police, through being in communities where to get anything, violence was the way you did it. And so that just gets transmitted. So there's kind of a transmitted generational violence trauma that had some impact there. So when we designed the campaign, it was also at multiple levels, sort of first trying to appeal to, the movement to a new South Africa kind of thing, getting beyond, some of that broader ramifications of apartheid, and then moving down to, social support for, changing, let's say, even parental practices of physical violence, which is, of course, what UNICEF wants to do. So that one's laid out as a very social ecological communication strategy. And, all of the projects, we tried to take that sort of holistic approach there.
Virgie has a question, and Virgie, you can jump in if I mess it up. She wants to know, and any, at this point there are not that many of us online, so you can just jump in and ask your own questions. You don't have to go through the chat. But Virgie wants to know how the social media strategies you mentioned in the Adelante project were developed, designed, and implemented, and if you can do that in 25 minutes or less, so more questions can be asked, that would be amazing.
I mean, there were a couple of strategies. There was a community-wide campaign where we had like bus posters and social media disseminated messaging, and all of that was, it was, the first thing we did was to try and get at, what kind of identity we could give the campaign. So there was a branding identity, and the identity was supposed to be an aspirational identity based on what the youth, wanted the project to stand for. And so that is that Adelante logo. And so there was community messaging, and again, it came in various ways. There was, like I said, there were some bus posters. There were other things like that. There was the social media messaging that went out, and then there were the YouTubes. And those were developed by youth who were in this. There was a group, an intervention component, which was essentially kids who were involved in developing the social media content, which is a strategy that we're also using in the SEAL project that I have now. But that, so they developed a set of scenarios and characters that they felt were representative of what they confront, of situations that they confront. And then one of the staff members at the Latin American Youth Center, also, he had a side interest as kind of a documentary filmmaker, and he made other films too. So he kind of took the lead in training on how to, how to set up scenes and how to film it. And he actually did a lot of the video filming himself, but he also trained kids on doing that. And so we managed to get 6 episodes filmed. And those were pretty effective, because basically each episode was, the kids who were in the group were confronting something. There was an impending fight in one. There was a girl who got pregnant, and the boyfriend was mad because he thought she got pregnant by this gang leader, and there was and then they had to confront the parents about this, and there were some other issues like that. They were all in these scenarios, and we tried to keep our hands off as much as we could. Every once in a while, we had to say, okay, this is NIH. Maybe don't use that word. Use this word. And we tried to have the presence of our project in there. So, somebody who would pick up a kid from school after he was expelled was someone from the Adelante program, and they drive them to where they need to go. So, just to let them know that, that we were a supportive presence there. So there was a lot of formative research with youth to do the brand identity, to find best communication channels, and then to develop the various media products. Hopefully that makes sense. And they were evaluated.
Thank you so much.
Evaluated in we collected data from, there was a sort of high risk cohort that we had a little screener. So for kids, families that were at higher risk, maybe they'd already had, school trouble, and they were in a cohort that we actually followed. But the broader intervention, we just, there's a mixed, this is not always, doesn't always get you the best data, but we used a cross-sectional, follow-up cross-sectional survey. So we did a survey of the community as a whole, and then a year later, a survey of the community as a whole. That is not the best strategy, as it turns out, for that community, because there's transients and that really kind of interrupt the value of the data. But we did measure, media exposure to program components, and so we had that and looked at outcomes as a function.
I don't know if anybody else is having this problem, but you sound to me like you're kind of breaking up now.
Oh, you know what? It could be my laptop, which is, I don't know, the mic is very weird on this. If I pull my face away or I turn or do anything.
Yeah, because now you're fine.
Yeah. I have to stick my face right in the screen.
Okay. Neil has a question.
Oh, can't hear you.
Neil, you're muted.
Not so much a question as a comment, maybe. Thank you, Mark. This is great. This is what anthropology is supposed to be doing on some level. And being able to move back and forth among levels of interventions, design, thinking, strategies, engagement with communities, and returning stuff to people is what anthropology can do in the right situation. Challenge to all of you folks is, how do we help those students out there who don't see this? They don't see the joy, the pleasure in doing our work. Even when you're in really bad places, there's still a lot of pleasure in being a good anthropologist and doing the right kind of work there. Too often students don't get exposed to this part of what we do. It's, hold up a watch a video, listen to somebody lecture at you for a very long time. And Mark, you talked for a long time, but you covered so much. I mean, this is great. How do we get students to interact with this? WAPA is a great venue. The whole video process that WAPA has been using for the last year, couple of years, is great. We don't attract enough students into this. How do we get them to come? Because, you know, it's like an hour once, it's not much, given what everybody else is doing. And we're all working, we're professionals, we do stuff, we're busy. We take the time out to listen to each other and create this community. So, you know, Mark, you kick these things off. You make me think about ethics conversations that go on in organizations where people haven't got a clue about what they're talking about. And these are the places all of this needs to come together and where our community needs to be able to speak for itself. So thank you. Thank you, WAPA. This is great.
Yeah, I mean, you know, it's very true. I think, you know, and I don't know, you know, without rehashing things that have already been done. I mean, is there a way WAPA can be a facilitator for, you know, have little internships or having, you know, students do, you know, ride-alongs essentially, or walk-alongs or whatever it is, so that they can see more than a book and a video. You know, they can see some of this stuff and see how it works. I mean, I agree. I mean, and I always sound like a nerd when I say this, but, you know, if I'm teaching in the qualitative methods class, I mean, you know, even like a program evaluation, and I know you've experienced this too, is, you know, one of the most fascinating parts is if you're trying to like figure out, like in that commercial sex thing, you know, talking with program staff, because this was an advocacy organization. So the staff were all people who'd experienced commercial sex exploitation and trafficking before. So trying to figure out, okay, what is their model of what this intervention is? Yeah, we know that they got a grant to do it, but you know how that goes. I mean, an organization is going to write a grant to what they're going to do what they need to do in the grant to get funded. But in reality, there may be something else going on there. And it's something like that, just hearing the story, it's like you're having a world revealed to you in a small way. And it's like, wow, this is not what the agency thinks this is, you know, and what they think is a successful outcome. I don't know, that may not be a successful outcome here, you know, because these stories what I'm, you know, hearing, and then, you know, of course, when it's reinforced by what you see and all the other multiple points of data that you get if you're doing anthropological work. I mean, it's like it's this, you know, this constant windows into human beings. And I know that's very cliche sounding, but it's sort of, I you know, there is definitely a wow element to that all the time. You know, there's also like an oh shit element to it too. But,
I have a question.
yeah.
A lot of what you've described is very inspirational. Obviously, I don't have to repeat everything Neil said, but I ditto that. And then just the question is this, and it's to everybody, but obviously primarily to Mark from all your experience. I'm going to just reference very briefly something I've stumbled upon, and this can happen to anybody in anybody's community, especially in this sort of pandemic aftermath, where we're looking closer to home. And I wound up picking up a volunteer activity of taking food from a community farm to newly arrived refugees. In the process, I'm getting a lot of that, oh, wow. This is only my second delivery in 1 month. But I'm getting some, because of being an experienced anthropologist, I'm seeing some things that are part of structures in play, and I'm gradually getting as much information as I can, but I'm seeing just disaster looming because of some of this structural things. The work that you've been describing, it sounds as if it was you wrote a grant proposal, or you were invited in, or that sort of thing. You had a large group of people and so on. Yeah.
Yeah, I mean, it's all grant funded. I mean, some of the stuff with the consulting firms is contract funded, but at the university, it's almost all, except for the UNICEF work, that's contract. The global stuff is contract stuff. But yeah, it's grant funded, and it's for that, it's kind of you have to develop it. If anybody who writes a lot of grant or contract proposals know this, I mean, you have to develop an iron stomach, because you're going to get some and you're not going to get some, and you may have a stretch where you don't get squat, and then all of a sudden you get 3 of them, and then or something, and and it's part of it's the there is a huge task of just constantly trying to figure out, okay, what's the funding spectrum right now, and that's governed by politics. I can tell you, we had a CDC REACH grant. That's racial ethnic approaches to community health. I didn't mention that one, but that was in the Latino community, and it had to do with diabetes and other things. And we got this grant was started right when the not to be named creature became president. And so immediately, hopefully I'm not offending anyone, but he cut the prevention funding by 30%. So all of a sudden, the little amount of funding we had for that project it's like 30% gone, and
But let me redirect just a little bit, if I could. It's not really about the question of funding. I was just making sure that I understood the source of your funding, but in this particular scenario that any one among us might find ourselves in, when we see things and they're all along the lines that you've been describing from your research in the projects, nobody's asking me for anything. I'm just witness to it. I'm very concerned about the missed opportunities and also the risk, and I'm not going to go into a lot of detail, but maybe you and I could talk about it offline. But in a word, the exposure of newly arrived immigrants, refugees who are here for protection, they're not being protected.
I mean, you're in a position. I mean, this isn't about grant funding. I mean, if you're seeing something like that, I mean, are you doing it with another group, or with together with some?
There are two groups involved. One is the refugee resettlement, and they're very protective of confidentiality, which I respect.
Sure.
The other is the community farm, and they're less experienced, but they're following the lead of. They're less experienced, so that means that they don't provide frames. So, for example, I'm not the only person delivering food. There are many people, and this is I live in Knoxville, Tennessee, so it's sort of second-tier city. It's a small community. This period of time has had a lot more migrants coming in from other parts of the country and so on. But it's a place that has a lot of sort of boundaries, segregated segments of society. So there a lot of affluence, and then there is a lot of shocking poverty, and then there's gentrification. And the refugees are all in the shocking poverty area, but they're bordering the gentrifying neighborhoods and so on. And I sit here in one of the suburbs, the outer skirts, which has a lot of natural beauty and so on. And the contrast of what I see when I do deliveries to where I go when I go home is just like, anything that we do in field work in emergent economies and other parts of the world.
I mean, is there any friendly news outlets? Is there any way you can, broker having someone cover that? Is there any way you can,
I feel it should be done. I'm going to do it quite slowly, very tentatively.
I mean, writing up descriptive every time you go make a delivery, and making sure that you record for your own purposes what you see, so you can put that together in
Yeah.
anecdotal pictures, and get that to whoever you think might be able to do something with it. I don't know if there's, a friendly congressperson or a friendly city council person or a,
There's a good mayor, as it happens.
well, I
Yeah.
mean,
There's city planners here and there. That's exactly the sort of thing. And I'm just not. But again, I bring it up kind of because I think it's interesting. Also because I think it sounds like a very localized version of some of the really, really significant and large scale work that you've been reporting on.
I'm sure it is. And I'm sure if you looked at the little project we did with, we did like 75 life history interviews with, recent migrants. I mean, some of the stuff that, that women told me they went through was just like, what? And part of, and we have a publication on that, but it is kind of an academic publication. And so that's not the best, those are human interest things. Those are, just realizing, this woman who was like they were, the coyotes they had they brokered some of the women that had paid them to take them across the border to cartels. And in this case, the Zetas, who are particularly brutal. And so, she talked about, she was in a warehouse with other migrants, not just women, but for, she said, it was a long period of time, like weeks or months or something. And they started dividing them up into, different groups, and they were threatening to take their body organs if they didn't get more money from their coyotes. And, and this woman escaped in a way that's sort of like, I just don't know that I would have the cojones to do that. She said that she was with this group of like 8 people, and there were 2 cartel people that were sort of watching over them, and they were drunk and they had guns, and they were playing basically Russian roulette, walking, they had them on their knees, and they were going up to their heads and, just laughing with the guns and putting the guns at their heads. And she said it was a dirt floor. And she said that what she did was, she whispered to the person next to her, and the person next to her, she said, the next time they walk around, grab the biggest handful of dirt you can and throw it in their face, and then let's run. And that's what she did.
And this is her narrative to you?
Yeah.
Mhm.
Or to the person who was doing that interview. I wasn't doing that interview. But that's what she said. That's what she said happened. Yeah.
Well, just to loop straight back, and then I'll yield the floor. But Kathleen asked me a couple of offline questions, which is about the refugee service, the agency, which is Bridge Refugee Services, and I am speaking with them, and they are also. I'm just going to go in, is what I'm going to do. I've known them for quite a while, but I'll just walk in for a cold meeting and tell them that I'm one of their volunteers, and I need to understand a little bit more about the collaboration that we've got going. But I feel as if it's something exactly as you're saying. I think that a healthy community is transparent, and it is truly fascinating, because what you just described, that it must be that sort of experience is part of why you leave the country that you were born in.
Oh yeah. And
Which
we were
is
collecting
not your first
information.
choice.
Yeah. Home. Yeah, absolutely. And that's a whole long story that I'm sure that the history of why people are leaving in the first place there, that doesn't get out in the media,
Yeah.
and so on and so forth. It's just, it's not there. But, insofar as we can get that into the public discourse, that's all the better.
I'll see. Maybe I can, you and I can follow up offline, and maybe Kathleen and I, since you were interested also. But it's an interesting situation to be witnessing, sort of frontline, and without very much effective structure.
Yeah.
So we have 5 minutes and 2 questions, and also I
Okay,
hope
I'll be quick.
some Neil's comment in the chat about February 19th, Day of Remembrance for the Japanese interrogation in World War
Ah,
II.
okay,
So
thank you, Neil.
go for it. Wrap it up with 2, I'm sure, really great questions.
All right, is there Adam, you have a hand up here? Or is
It's
that
Adam and Kathleen.
Kathleen? Yeah,
Kathleen,
go for it.
You wanna?
Oh,
Okay, I just wanted to circle back around to Neil's comment about getting students involved, and I only have a few minutes now left, but WAPA in the past had a far more representation in universities. We had far more professors, and it's supposed to always be a mix, but on this call here, it looks like very few people have a foot in a university. Mark is one of them. But yeah, and Ron, and
Ron
yeah,
has, yeah.
okay. So, but there were times when professors really strongly encouraged their students to attend WAPA. But another thing that's come up a lot is students getting sent to various people that, if you join WAPA, there's a whole scattering of topics. But for instance, a lot of people that I know send me students if they want to do disaster stuff or international economic stuff. So one idea I wanted to kind of raise is that one-on-one mentorship. I'm mentoring like 6 people now, casually, off and on, who want to do disaster. Thanks. Who want to do disaster stuff, and that whole the whole ride along thing. I can't bring them with me to FEMA, but the whole one-on-one kind of relationship. So it's like one student at a time.
Right.
But we do need to pull students into this kind of work. And I had a student yesterday who I spent an hour and a half tell me that none of the stuff that I said they had ever learned in any single class. And that's not about me. It's about how people are being taught and how they don't have the contacts. They don't have the connections with practitioners, and especially in a field or subfield that they want to get into. So I think, there's scope for us to do far more of that.
I think so. And then we'll have to, brainstorm a little bit how to do that. And, maybe WAPA members could go talk at classes too, things like that, yeah, something. I'm getting some signal that I'm supposed to do something like end everything.
No, two things. First of all, there's an opportunity for WAPA and NAPA to collaborate, and for NAPA to promote the YouTube channel and the WAPA meetings. I think that's an opportunity to bring people back around to the live meetings. Mentoring, NAPA has a big mentoring program, as does WAPA. We do sessions at all of the meetings that are really intended to bring students into connection with professional anthropologists. I think there are obvious collaborative opportunities, and I'm now past president of NAPA, so I can't commit NAPA, but I have peeps. We could certainly talk. I got peeps. We could promote the idea of sharing the WAPA YouTube channel and promoting the different meetings that are going on. So it's an opportunity.
All right, so this is a whole area of discussion that we need to follow. All right, I think we're out of time.
Yeah, but we have 2 minutes. Do you want to say something presidential with the last 2 minutes?
Something presidential. Walnut to Prilly when the shooter sued to the drought of March has been, I don't know, something. Let's see. I don't know where I remember that from. Some English teacher once did that in Middle English. No, I think, I mean, there's a whole basket of issues like that, you know, and as fast as I can get to it, you know, we'll try to follow up on, but, you know, I want to, you know, really thank everyone for being here, and just, you know, thanks for having any interest in me as president, as administratively challenged as I often am. Hopefully we can follow up and get some stuff done and make happen. We
Well,
need to have a band show. That's what'll bring people. Band show.
Thank you so much, Mark, and thank you everybody else for coming. Next month we're going to have an amazing speaker. It's next month is Women's History Month, and we're going to have a speaker on women war resistors during the Holocaust.
Oh, great. Yeah.
Keep the and I don't want to have too much levity with this subject, but to keep the rock star thing going, I will be opening. Myrna Goldenberg is truly a star, and I will be opening with some comments from some recent work of mine.
Excellent.
And we love to have more people come and present on their work.
Great. And we will soon return to in-person, you know, events. I mean, or at least parties. At least we will do that, which is at least the first step in re-gluing the network. So hopefully that will happen in the spring.
Yeah. Thank you again.
Don't leave out the Wondering What Peace does in Knoxville and
Oh,
California.
no. And yeah.
Okay.
No, we won't leave you out. And Kathleen and Neil, I will be out sometime to Sacramento. I don't know when yet, but sometime later in the spring or early summer. So,
Okay.
all right. Thanks, everyone.
Bye,
and
everybody.
Thank you.
have a
Bye.
happy Anthro Day.